Welcome, 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 Tania. This is your second video for module number 2 of learning the right treatment. Okie dokie, so let's crack right into it because I hate listening to my own voice and I'm going to put up with me for the next hour, so we'll get on with it, okay? Excellent. So we've already gone through module 1, of course, in the previous video, just giving you the outline of what the right treatment is and what our intention is, etc. Now we're going to get straight into the actual procedure of the right treatment. So module number 2, recipe for the right treatment, part 1. How exciting. Let's go. Right, okay, straight into it. The intention is to assist client to obtain and maintain pain-reduced or pain-free lifestyle. That's what I want to do. That's my whole intention in life. This is to be achieved by A, educating and empowering the client, and B, using a blend of gentle, non-invasive and holistic hands-on techniques, aka the right treatment. So preparation, get yourself ready. In order to be successful, you must always prepare and set a clear intention of the desirable outcome. You will notice we use the word intention frequently. Why do you think this is? Take a few moments to consider your response. I'll hum to myself. It's rhetorical, really, because you can't answer me because this is recording. Okay, so let's move on. Setting the scene. Always having a clean and tidy treatment area. No clutter, no distractions, no unsightly images. I can say magazines. I suppose that still applies too. Remember to see through the eyes of a beginner each and every day when you set up your clinic. A first timer. Many clients are not comfortable with images of naked bodies, bare torsos, exposed body parts, whether in cartoon form or photography or artwork. And I learned that to my expense a couple of times over the years, actually. So in my clinic itself, I don't have any imagery of the walls at all. It's pure simple. However, that's also because I'm in a rented apartment, a rented house. I can't put things up on the wall. But I don't even have statues. I don't have anything on display. But I do have my beautiful posters of anatomy. Anatomy and physiology, just in a cupboard around the corner. So if I need to point to a certain muscle or muscle grouping or explain something to somebody who's a visual learner, I can go to my cupboard and I can pull out the posters and put them on the table and explain where I'll be working and so forth if need be. Okay? It doesn't happen very often, but it's there, it's all prepared if I need to do it. Okay. So unwelcome images or clutter, etc., will create a barrier between the client and yourself, and it really does. If their eyesight becomes busy and overwhelmed by too much stuff going on around them, they can't hear what you're saying. However, note, total silence can be unnerving to a nervous client as well. So sometimes I'll chatter as I'm doing the treatment, and other times I'll go dead quiet other than the instructions I give our clients, as you'll learn very shortly. Sometimes I'll put music on in the background. Once I know the client and their needs, we can adjust each treatment to suit themselves, to suit them, I should say. Ensure treatment table is clean and tidy. If using towels, make sure they're clean and not stained. We suggest dark coloured towels or coverings to assist with staining from oils or such, not being so visible. You don't actually use oil in the right treatment, but I envisage that a lot of right treatment therapists will be doing other therapies as well and using the table for all of them. So just bear that in mind for future. Fresh linen always impresses and portrays professionalism, and yes, clients will notice any stains or wear, etc., but only 1 out of 10 will comment to you. However, most will comment to outsiders, therefore damaging your reputation. Don't skip on basic presentation or it will cost you dearly, and you may not even know why, as many clients won't tell you. Use a natural disinfectant spray to wipe down the headspace in between clients and whole table once a day. Make a point of showing delicate clients that you're doing this so fear of infection or contamination is removed. Do not clutter treatment area with brochures, multiple products, etc., as this can confuse the scenes, particularly when clients presenting with anxiety or depression, which is becoming more and more the norm, actually, unfortunately. Follow the KISS principle, which is keep it simple, sweetheart. It's supposed to be keep it simple, stupid, but I don't know any stupid people, so I call everybody sweetheart. Follow the KISS principle to assist with connection and communication. So just keep bringing everything back to this simplicity, simplicity, simplicity. Jargon just doesn't help people unless they're actually trained therapists themselves or they come from that background. But jargon doesn't help anybody. They come and say, I've got a sore neck, use that terminology. If they come and say, I've got a sore sternocleidomastoid muscle, use that terminology. Follow their lead to that on that particular aspect. Always, without exception, wash your hands up to the elbows, all the way up with soapy water. in between each client. Okay, I've tried using this Ditto stuff because it's a walk for me to go from clinic to the bathroom each and every single time. This stinks to high heaven, and it's disgusting, and it makes my skin crawl. So I just go and walk to the bathroom every day, in between each client. But it's actually a good way to step out of the environment and to free yourself of any attachments as well. So when I step away from my clients and I go out to wash my hands, it is a conscious thing that I'm doing of washing my hands to wash away all the stuff they picked up from their body, but also the energetic connections as well. And I'll actually brush myself off as I'm walking to or from the clinic as well. So I'll brush myself off. Yep, and then I'll come back into the clinic refreshed. Okay. Begin each interaction with clients by being settled within yourself, grounded and present. Do not allow outside distractions to seep your energy. That is really, really important. And it doesn't matter how busy your life is, clients don't particularly care. They're there to see you and only you. They don't want all the distractions going on. So for example, I allow the dogs into my clinic, 95%, maybe as little as 90% of clients love the dogs being here. But one of the reasons why the dogs are in the clinic is because if I put the dogs out of the clinic, we get barking and scratching and carrying on and running up and down the hallway and so forth and stuff like that. When they're in the clinic, they settle straight down because they're in this energy field. But when they're outside of the clinic and they can't get join into the energy transference, then they become disgruntled and unsettled. So I bring the clients in, of course, but I bring the dogs in as well and let the dogs settle. Plus, as a side to this completely, I have noticed the dogs are great healers, and the healing starts as soon as the doors open and people are on their knees petting the dogs anyway. So it's been beneficial. Okay, so here's a method. Greet client with an open body language. Try not to have anything, i.e. a table in between the two of you. Ask open leading questions to obtain history surrounding the issue they are presenting with. I know this is all bog standard to you, Tan. You've been doing therapy work for as long as me, if not longer. But we're still going to go back to basics with any sort of training. So we'll whisk through this really fast, okay? Watch their body language. Listen with both eyes and ears. As you develop a natural healing, you will learn just as much from their body language as you do from their words. Continue questioning until mental picture forms a cause of discomfort. Listen and repeat keywords back to them to ensure that you understand correctly. Really important this day and age because we've got so many different nationalities coming through. Be sure to ask any serious health issue such as heart disease, diabetes, multiple sclerosis, car accidents, impact injuries, etc., etc. I myself don't keep a written note of clients' issues anymore because I've just got one of these brains that has a meticulous way to pull things out, which is quite amazing. I have also found keeping written note of clients' details can be a barrier between myself and the clients. They feel a bit uncomfortable you keeping written things, and they haven't built a rapport yet. They've built a trust thing. There's an issue there. So I experimented by not keeping notes for about 2 years and found it made no difference whatsoever to my standard of treatment, but it made a big difference to the connection between me and the client and their trust and respect for me. As a safeguard, finish the questioning with, have we covered everything or is there anything else I need to know before we begin? And then go quiet and let them fill that pregnant pause with an answer, okay? For new clients, give a brief outline of what you plan to do. As a tip, we find it helpful to demonstrate your finger movements on their forearms so they can feel the pressure to expect, but their eyes can reassure their brain at the same time. Because when we're actually doing the right treatment, the majority of the right treatment is done with them laying on their stomach. So they can't see what you're doing. So I find that by showing them, by telling them to literally saying, may I borrow your forearm, and imagine this is your spine. And I have their forearm from the elbow down to their wrist, and I go down, I do the treatment, a miniature version on their forearm saying, hey, this is the amount of pressure we're going to use, this is the type of the movement I use, and this is the reason why. Boom, boom, boom. And as soon as they get that, the putty in your hands, kind of, so to speak, they trust you a lot more. So going back to having a body chart close by you so you can point to it when explaining cause of pain, what you're about to do, and ask them to identify your sore point. So I mentioned that before, I've got it in the cupboard just in the corner. Some people are visual learners, other people just go, I trust you, do whatever you need to do. So you'll find the range between of who needs to see the chart and who doesn't. Before touching a client, it is important to ensure you have asked permission to do so and to check that you have built trust with them. Repeating some of their questions and answers, to the above is a good way to build trust, as it shows you've been listening, are attentive, and that they are important to you. Even though they come into your clinic, you still need to ask permission again. Very, very important. So even though they have voluntarily come into your clinic, they've made the appointment, they've set the intention, they've walked into your clinic, and they present themselves to you, there's a big step between them standing there and you not touching them to when you put your hands on them. So always, 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 always look at them in the eye saying, is it okay for us to proceed? Is it okay for me to touch you? And I'll wait for them to say yes. At that point, you can get started. If they still appear hesitant, go back to questioning and focusing on building trust before proceeding. Now, in extreme cases, and in all the years I've been doing this treatment, I can't even begin to tell you how many clients I see a year, but in all the years I've been doing this treatment, I've had one person who I have gently said, I'm not going to treat you today. I want you to go away and think about what was said today. I want you to come back when you feel that you can trust me. And it's not that they said, I don't trust you, but she was way too hesitant for me to actually put my hands on her. And I felt that it was going to affect her more emotionally in a negative aspect than it could have been in a positive aspect, and I'm not that cup of tea. So I sent her away, and about a couple of days later, she came back. But if I remember correctly, because it was a long time ago, if I remember correctly, I even invited her to bring somebody with her, so there's someone else in the room, just to build that extra step of trust with her. It is very rare, though. Do not allow or instruct client to remove any clothing unless it is too bulky to work through. Leave 2-sheet thickness clothing on them at all times, and on you, of course, for both their and your protection. Get clients to remove belts, glasses, and or footwear. You'll have some people to walk into your clinic and they'll strip off to being bare butt naked if you don't stop them. I've had quite a few walk in here and they go, oh, I'll just take this off, and they start to strip things off and start to undo their belt buckle and kick their shoes off, and they're about to drop their decks and all the rest of it. So, hey, dude, just slow down. It's going to take way too much time and effort to put all that back on at the end of the treatment. So keep your clothes on. All I need off is your jumper and your belt. That's what I need. If they're wearing jeans are very hard to work through. So I may get them to remove jeans, but if they remove the jeans, I bring out a towel, and as soon as they're on the table, the towel goes over their legs to cover themselves up, because there is a couple of movements here that requires them to spread their legs. So out of their protection and your protection, I put a towel over their legs. If they've got exposed legs and they just wear knickers, particularly G-strings and that sort of stuff, I put a towel from their waist down, okay? And then I'll just move the towel. If I'm working on the right leg, the towel is flipped off their right leg, just like you do when you're massaging, and I expose the area that I'm working on. If I'm working on the back, I pull the towel down just below the gluteus maximus muscle, and then that's all that gets exposed. But this is very similar to massage, so that it will be familiar to you, okay? But don't allow anybody to harm, please. Don't allow anybody to lay on your table face up, particularly males, face up without any decks on. And because when you get them to do the leg maneuver, they will be dropping their hip out to, dropping their knee out to the side of the table, and it exposes the whole genital area. And it just ain't comfortable for anyone, okay? Particularly with considering where your fingers are going to be. Okay, marvellous, moving on. Positioning. Start with client laying supreme, face up on treatment table. You may need a step to assist client to get onto the table, or a table that can move up and down to suit client's needs. Be aware of clients' needs. For example, they may need neck support cushion. Supply support if required. Ensure their body is straight. Do this by standing at the foot of the bed and looking up the length of their body. Gently reposition body if required by taking hold of both ankles and very gently, tugging whilst gently rocking the body side to side. Get that word gentle is in there a few times for particular reasons. You may need to gently, there it is again, lift each leg and reposition. Also advise the client when you're what you're going to do before you do so. Okay, getting into the treatments now. It's the nitty-gritty. First optional treatment is the knee squeeze. To be used if ankles are out of alignment with each other, so that signals pelvic misalignment. So when they're laying on their back on the table, and this is their feet, okay, you notice that one leg is longer than the other. This is when we do the knee squeeze, okay? Ask or assist your client to raise their knees and place feet flatly, slightly apart on the table, as close to the rear end as possible, as comfortable. Keep the knees together. Place a flat hand, that's your hand, on each side of the outer knees. So if the knees are here, let's make my hands. I imagine there's a peak here for the knees. My hands coming like this, okay? You'll see this in the demonstrations and the videos that I've sent you as well. I'll give you the connection to the link to. Well, as an alternative, wrap your arm around the client's knees. Now, I actually choose to keep, if I'm standing here, most of my body, this hand goes here. And there, so you can see the hand goes there because it also protects my breast, okay? And then I wrap that arm around that way. And I do that 9 times out of 10 for guys who come in here or fit young women, because otherwise this dear old girl gets pulled off the side of the table. Sometimes, very rarely, but you're struggling against them. That puts stress onto your back, and you're standing at a funny angle. You don't want that stress. So I tend to wrap my arms around the knee and hold it there with my massage infused muscles. You know how developed we get. Like sumo wrestlers. Okay, getting back onto core here. Here we go. Place blah 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 blah. Instruct clients to engage their core muscles throughout the following exercise and ensure their lower back remains flat on the table. Tendency for them will be to arch their back, so this instruction is very, very important. We need that lower back flat on the table, or we could be encouraging some problems. Instruct client to engage their core, we've done that, blah, blah, blah. Instruct client to push their knees outward by using their leg muscles, not back muscles. So we're talking about the quads, okay? And not the back muscles. Pushing against your hands or arms so the resistance module is attained, okay? So I've got here's the client's knees, I've got my hand here, arm there, and I go, right, take your knees apart, and as they take their knees apart, I hold. And there's that resistance going on. Hold this resistance module to the count of 10 seconds. I can tend to count backwards. 10, 9, 8, 7, 6. Just something I trained in a long time ago when it came to management and psychology, okay? Instruct client to relax and move your hands to the next position as follows. Ask client to open their knees apart by about 30 centimeters, so yay, about that far, okay? But their ankles don't need to move, it's just drop their knees out of it, okay? And place a flat hand, again, it's your hands, on the inside of each knee. So if this is a client's knees and they're just open, my hands go inside and I do that, okay? All right. Remind client to engage core muscles again and keep back flat on the treatment table. Instruct client to bring these together whilst you resist this action. Hold this resistance module for a count of 10 seconds again. Repeat both resistance modules again once more. Finish by testing hip flexibility by bringing both knees together, feet still flat on the table, dropping knees together to one side as far as they go comfortably and then to the other side. Yeah? The patient's laying on their back and their knees go that side. Now also engage their head to go the opposite direction, okay? And then come up in the center and then go back that way. All right, just checking how things are going on there. Client is often surprised how quickly they feel release and increased flexibility. Lay both legs out flat, recheck the leg length to ensure ankles are even. Repeat the knee squeeze if required. So if the legs are still slightly longer than the other, don't hesitate, go back into the knee squeeze again. Do so until the legs are of even distances, or you have obtained information that they have always had one leg shorter than the other, because there are some people who literally were born that way, and I can't change it regardless how often I do the knee squeeze. Okay, this is for people who have got misalignment, not misdevelopment. Okay, second, optional extras. Now, when I say optional extras, I do these anyway because I find them so complementary to the main core treatment. And majority of Homo sapiens are standing on their feet for long hours of the day. So these two treatments, even though they say it's optional treatments, I would jump in and do them 90% of the time, if not more often. So this is a lower limb alignment. Although listed as an option, it is highly recommended you undertake this treatment as with each right treatment application. It's almost like I wrote these things. I knew how to say, knew when to say that. Okay. With clients' legs flat on the table, find the alignment of the hip bone and locate the femoral artery. See the image and the video link. So there's a video link at the end of module 3 for you to get some video on this, but you've already seen them anyway. But it's there for you now to go back and watch. Oh, look at that. I'm so freaking clever. There's also the link down here, okay, for obtaining the femoral artery. All right. Position index and middle fingers of both your hands in a V formation, like that. There's your V. And there, when you're doing both your hands, that's the V. Okay. All right. See the V? See the V there? Yeah. Okay, if I'm just using one hand, that's the V. Position index and middle fingers of both your hands in the V formation onto the client's femoral artery. Instruct your client to bend their knee of the leg you are treating towards their chest. As they raise their knee, compress the artery gently and complete a small circular motions of fingers, one going clockwise and one going anti-clockwise. Once the knee is fully bent, boom, instruct the client to drop the knee out to the right angles to the body like a ballerina doing a pirouette, okay? Instruct client to straighten the leg back into the beginning position, and whilst they are doing so, complete the following action. On the downward motion of the client's leg, bringing both your index fingers move together, keeping both your index fingers together, these little fingers here, move those two apart. So you've got that scissor action going on, okay? On the downward motion of the client's legs, keeping both of your index fingers together, move your middle fingers away from index fingers in the scissoring action, being very gentle and not applying too much pressure to the femoral artery. It is very common to hear the hip joint click at this point. Instruct client to raise the knee towards chest once more. As they raise their knee, compress your general artery gently and complete a small circular motion with the finger. Once again, 1, 2, 3. One hand going clockwise, the other one going anti-clockwise. Once fully bent, instruct client to turn the foot outwards towards the opposite knee. So here they are, like this, with the leg laying down, this knee's coming up. All right, so the knee's up. Now they turn the foot so it's facing that knee. Okay, keep the foot flexed. Make sure they don't don't drop the knee out. Their tendency will be to do what they did beforehand because they've done it once. They think it's a repeat action. So be very clear that they bring their knee up. They do not drop the knee out. They just turn the foot in to face the opposite knee, and straighten the leg straight down that leg. Okay, so do that again. Here's the leg that's on the table. They bring this knee up. All right, it's nice and bent. They turn the foot so it's facing that opposite knee that's still laying flat, and then they take that leg down that knee. They straighten that knee down the rested leg. Okay. A cat stroking a cat. A cat stroke cat. Like you petting a cat, they put it that way. Okay, once the foot is fully flexed, instruct the client to straighten the leg, but keeping the foot flexed inwards until the leg is flat and resting on the table again. When our client is straightening the leg, on the downward motion of the client's leg, keeping both your index finger together, move your fingers away from index fingers in a scissoring action, being very gentle not to apply too much pressure to the femoral artery. That's what we did before. Okay, so the same as when they pop the leg out, drop the knee out, bring the knee up, twisting the knee, and as twisting the foot, fixing the foot to the opposite knee, and as they straighten that leg down, your little fingers on the femoral artery, okay, in that motion, you go 1, 2, 3, out. So they're going down the leg, you go out like that. Moving down your client's body now to stand beside their knee or the patella, place one hand in a fist formation under your client's knee and instruct them to totally relax the leg. Place your other hand on the kneecap with your thumb to the other side and your ring finger, small finger on the inside of the knee. So just imagine there's a leg here, okay? This fist is underneath the knee, underneath the patella, okay? This hand comes up and I do that. Okay? Gently grip the kneecap and slightly lift it up, rotating 3 times clockwise and 3 times anti-clockwise, then release. It's very, very gentle. Using your middle finger, trigger release approximately 2 centimeter intervals upwards towards the groin, going no higher than the miniskirt level for privacy reasons. Following the adductor longimus muscle, see image. So here's the adductor longimus muscle. It's a bitch of a muscle when it's tight. People go ouch, 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 and squirm and try and get away from you if it's in problems. So we start here, roughly speaking, here, just above the patella. We go 1, 2, 3, then we move up 1, 2, 3, then we go about 1, 2, 3. That's about where I finish around here. Any higher and it starts getting quite intimate, okay? All right. Remove your fist from behind the client's knee and place that hand flat against the client's outer hip area. You're going to use this to rock the body gently for the next part. Using the thumb of your other hand, trigger point down the length of the client's IT band, whilst gently rocking the client's lower body. So it's here, 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 okay? I usually go down 4. It depends on the height of the client. The older the client, the shorter they are, thanks to gravity. But generally, I get in about 5 for long-legged people and 4 for the rest of us who are starting to go southward in their height. Okay, move to stand in the foot of the bed and look up the client's body. Place your hands around the client's ankle with your fingers spread over the tarsals. This action requires a little bit of bending and twisting on your behalf. Okay, so this is where having a bed that goes up and down is really handy, but if it doesn't, then we move on anyway. Rotate the foot inwards 3 times whilst applying light pressure to the tarsals, then rotate outwards 3 times. Place one hand under the ankle, the other on top of the foot. Gently high press, extend foot downwards, downwards. Gently hyper extend foot downwards towards table. Okay, I'll just put the word towards in there. So Dixie for a second. Towards table, then gently push foot back up towards the shin bone. Gently shake the foot to finish the tarsal treatment. To finish lower limb alignment procedure, place one hand under the leg slightly above the ankle, the other hand holding the foot. Pull gently so the whole leg is extended, towards you that is. Release and then repeat the pull. At the end of the second pull, flick the leg once, like shaking out a bed sheet. Gently settle leg onto the table and repeat lower limb alignment for the other leg. Okay? All right, so that's all double Dutch at the moment, but that gives you the base, and then you can go and watch the videos that were shot as well, okay, to give you a visual of what I've just been saying. So let's move on to the first compulsory procedure. Have the client lay face down, which is prone, onto the bed treatment table. Best to have a table with a face hole so the head can remain straight and muscles do not get twisted. Waistbands can be too thick to work through, but before moving waistband out of the way, ask permission and then only move the waistband down as far as the gluteus medius. That's just under, around about where the gluteus maximus and the gluteus medius sort of meet, okay? Ensure their body is straight. Do this by standing at the foot of the bed again and looking up the length of the body. Gently reposition body if required by taking hold of both ankles and very gently tugging while gently rocking the body side to side. You may need to gently lift each leg, reposition. Always advise client what you're doing before you do so. Copy and pasted from the instruction earlier on, as you can tell. It is best for the patient's arms to be either by their sides or over the edge of the table, leaving their chest directly on the table. Some women may find this uncomfortable, so a rolled up towel placed directly below their breast removes a lot of the pressure. Okay, once the client is in position, stand yourself at the side of their body and place your hands flat over the heart. One of your hands flat over the heart. Place your other hand over on their body just below their navel. Hold this position for 5 to 10 seconds while breathing slowly and deeply. It is during this time that you're inviting connection with your client and setting the intention to be a portal to their healing. Therefore, it is empowerment that you are focused on them and their well-being, and nothing else should be on your mind. Start rocking the body gently whilst still setting the intention. These last 2 steps are termed introducing yourself into the aura, mind, body, and soul. This is where deeper connection starts, and often you'll feel client breathe deeply and relax. This is a physical sign they are ready to begin and ready to receive healing. Introducing yourself can take up to 30 seconds. New clients can be longer. Do not speak during this time. Close your eyes, visualize nothingness, and simply be present. Placing one hand flat on the base of the spine. Use the middle fingers of the remaining hand to trigger release of gluteus maximus and medius, hot spots, see diagram, by depressing the spot and rotating finger at the same time as rocking the body. So once again, these are in the videos, and if you need any more sort of chat about it, we can get together and chat about that, it's okay. Reposition trigger fingers to the base of the longer medius muscle and repeat the action of depressing finger, rocking it and rotating it and rocking the body gently for 3 applications. Reposition finger for the third time to below the illustrated position and repeat the action. So we've got outer, middle, and then inner points, okay? Press it down, rotate 3 times, 1, 2, 3, at the same time, rocking the body very gently. Keeping your stabilizing hand at the base of the spine, now flatten your other hand and move to the side of the hip closest to you. Using the heel of this hand, gently push up against the hip, causing the body to gently rock. 3 times away from you. Move hand to opposite the hip, keeping it flat, and now gently pull the hip towards you 3 times. Position your fingers on either side of the T3 vertebrae. It's the images below. Ensure that you are using the inner edge of the fingertip as this is a powerful energy source. So here's your middle finger, and you want to be using the inside of that nail. There, right there, right there. So there's our T3 just on the hump of the back. Another image of it just in here. See the spine T3s right there. Okay. So you know all this already. Instruct the client to breathe in deeply to the count of 3 and hold his breath as they breathe in. Complete the first half of the movements as follows, using your inner fingertip of your middle fingers. Remember that point I just pointed out just then on either side, okay? These are your middle fingers, not being rude, but these are the power centers, okay? I wonder if that's why people do that, because it's so powerful. But anyway, that's not what we're doing here today, okay? Using the inner fingertip of your middle fingers, rotate the fingers inwards towards vertebrae, anti-clockwise for left fingers and clockwise for the right finger. Fingers are to move out of sync. Notice how I'm doing that. I'm not doing this together, I'm doing it out of sync, okay? For this part of motion. Complete the 3 rotations, and on the end of the 3rd rotation by traveling up the vertebrae to the up towards the end of the vertebrae. So start that again. 1, 2, 3, up the end of the vertebrae. Timing of these rotations and the completion flick should be that the client finishes breathing in just as you complete the flicks again. Okay. Rest for a moment at the end of the flick movement. Instruct the client to breathe out. Don't forget that part. So they will follow you. Some people will follow instructions to the T, so it's really important we remember the breathing in and out and in part. Otherwise, we get people running out of breath. Okay. Breathe out. As they do so, complete the second half of the movement as follows. Using the same point of the fingers, complete 3 reverse actions. 1, 2, 3. And as this time the fingers are moving in sync, on the 3rd rotation, complete the move with the tail down towards the starting point. Okay, we're going to start from the beginning. We just started. Breathe in, please, patient. 1, 2, 3. Hold and breathe out. Okay. It's extremely important to perfect this movement before continuing training. Spend some time now practicing this until it becomes fluid and rhythmic. Okay. Suggestion to practice until confident. Get a paper plate. And some corn flour. Put corn flour onto plate and practice this basic movement. By using the flour, you'll be able to create a visual effect of your movement and to monitor how you are developing. Okay, but you've been practicing anyway on people, which is cool. So that's the end of module 2. Alrighty, so that takes us there. Fantastic. So on to module 3. Fantastic. So exciting. Stop recording.